Good morning. On behalf of the Hospital Authority, welcome to the groundbreaking of our new $40 million hospital right here in the geographic center of Polk County. This is undoubtedly the most important development in healthcare facilities for our county since Polk General Hospital opened in 1947, and is by far the largest investment in healthcare facilities ever in Polk County. Prior to 1947, some of the doctors operated small hospitals in conjunction with their offices, and notably the Hall Chaudron Hospital on Herbert Street, where a lot of us that were born 60, 70 years ago were born. But if you needed to be hospitalized during this time frame, you went to Rome, to Floyd, or to McCall's Hospital. The Cedartown-Polk County Hospital Authority was created under a Georgia law that allowed local cities and counties to create it. It is a statutory, self-perpetuating authority formed in May 1946 by enabling resolutions of both the city and the county. It was formed for the specific purpose of building, owning, and operating the hospital in Polk County on North Main Street in Cedartown. The hospital opened in 1947, originally licensed for 58 beds, laboratory, emergency room, radiology, surgery suites, and a maternity ward. It was built on donated land with donated funds, along with some funding from the Hill-Burton Federal Act for Rural Hospitals. Through the years, changes and additions have been made to the building and the services offered, with the authority always mindful of our original goal of providing the best healthcare facilities possible right here at home in Polk County. The present members of the authority are Bruce Casey, Lee Cummings, Darrell Freeman, Larry Kugler, Richard Jewell, Frank Shelley, and myself. The authority operated the hospital directly until 1956, and at that time determined that all the changes going on in the healthcare field, it would be better to align with a larger medical group. We entered into a lease with Redmond HCA to operate the hospital for us from 1996 until 2011. Early in 2010, realizing the lease was beginning to expire, we started dreaming about our possibilities and planning on our options for improving our facilities and services, which was our stated mission as far back as 1946. We hired Stroudwater and its president, David Whelan, nationally recognized hospital consultants, to guide and advise us in this effort. They invited all the larger healthcare providers in the area, including Carrollton, Marietta, and Atlanta, and even some from out of state, to submit proposals to us for new healthcare facilities in Polk County. After reviewing all the proposals submitted, conducting selected interviews, and assimilating all the information available, the authority determined Floyd's proposal was the best structure providing both health care for both the short and long term in Polk County, and we chose them to partner with. They are a nonprofit, public, community hospital organization like ourselves, and all of the profits from the operation of the hospital will remain in Polk County to be reinvested in continually expanding and improving our health care. The new facility will be owned by the Hospital Authority and leased to Polk Medical Center Incorporated under a 35-year lease to operate the hospital. Polk Medical Center Incorporated will be governed by a local board of directors from Floyd and our authority. Floyd took over the operation of this hospital April 1st, 2012, and immediately began planning for this facility. The fact that we are ahead of schedule and under budget, which is extremely rare for projects of this size and complexity, is indicative of the long hours and hard work by all the team members that have gone into getting us to this groundbreaking today. The authority is not only delighted, but excited to partner with Floyd on this marvelous new facility. Quality health care and economic development and expansion go hand in hand. Not only is this a major improvement for health care, but it should also provide a tremendous stimulus to economic development in Polk County. By what this groundbreaking symbolizes today, We are not only providing state-of-the-art healthcare facilities for our local citizens, but we are also greatly improving the environment for economic growth and development and increased prosperity for all the citizens of Polk County. To paraphrase the Indy 500 starter, ladies and gentlemen, let's get it built.